Welcome to the HR Empowerment Podcast, where we will uncover strategies and new insights from HR professionals who discuss up-to-date regulations, best practices, and the most pressing topics like diversity and equity, leadership, dealing with difficult situations, and much more that affect your bottom line and business. Thanks for joining us.
Hey everybody, Wendy Sellers, the HR lady. Thanks for coming back. We are here talking to an expert, Michelle Shepard, on nutrition in the workplace. Hey Michelle, thanks for coming back.
Hey Wendy, thank you so much for having me.
Sorry about that. I had to clear my throat there. Maybe there's pollen in the air. Maybe I'm not eating correctly. I know I'm probably not, because I love bread. I just love it. Is it that bad for you?
You know what? At the risk of being staked by the many diverse health coaches out there, I don't actually think it is. I think the amount of bread we eat and what we eat it with might be a problem, but bread itself in moderate amounts is totally okay. And I have a piece every morning. It makes you feel better.
Oh, good. I'm so glad to hear that, because it is my favorite thing. If I don't have carbs, someone's going to get some angry face.
And sourdough is love, right? Like there's just something about that.
Hey, talk to us a little bit about, the benefits of health and nutrition coaching in the workplace, and what the heck that even means. Like, what do we open a doctor's office in there? Do we, pay for unlimited services? What are we even talking about when we talk about, hey, employer, we're going to start offering health nutrition coaching? And then how does that affect employee engagement and morale? I know that was like 4 questions in one there, but what do we even mean by health nutrition coaching in the workplace?
So I love that. And that's how my brain works. I like a good, I can string it together. So we're on it, Wendy. And so health and nutrition programs traditionally have looked a lot like either just screening, like your essential, like your insurance stuff. Like they come, they do blood work and they do blood pressure, and then they get a handout after of like, eat less salt to do this thing. Or they look like lunch and learns. Someone comes for 1 hour, maybe 3 months later, somebody else comes for 1 hour and talks about different things. And while all education is valuable, the outcomes of that are not going to be particularly good, right? If you're training an employee, you don't give them an hour at one thing, be like, okay, bye. And like, I'll see you in 5 years. It's really important, if you want that ROI that we talked about in that previous episode, that your program is both a bit personalized. So ideally opportunities for some one-on-one with a practitioner, or at least they have been able to take your demographic, right? Like your age, where you guys are, what the challenges are in your group, into account. And then the biggest piece we see in the research on workplace wellness programs is that it's ongoing. So 3 months is usually the minimum where we see that really nice improvement. So you've got that series, you've got some change, you've got some community building. But in the bigger literature, so some of the studies we talked about, the 6 months plus, or those ongoing ones, even if that's a once a month or once a quarter thing, have the most impact, because you're getting that kind of sequential care, right? Clients are staying engaged with it. Your employees are staying engaged. It's not lost amongst all of the crises that we deal with on the day-to-day.
And then, also having the unlimited candy machines and or free candy laying all around. And does that need to go too?
I think if your workforce is young, like if you've got a workplace full of like 20 to 29-year-olds, have them choose what candy they want in that bowl. But I can guarantee you, as someone who talks to hundreds of clients, all 35 to 55 every year, we don't want to fight the donut date. We don't want to awkwardly decline, the pizza Friday. It makes it harder, right, to navigate food after food after food. We want things that make us feel better, that don't make us feel like crap. And so I think navigating that environment part can be really important, and a good consultant should help you do that in a way that's not restrictive, because I love pizza and I love sourdough, but it should not be the pinnacle of your engagement strategy. It's not effective, and it's probably harming your bottom line.
Yeah, I love that. As a former HR director, it was so hard. It was a struggle. Like, hey, we want to be focusing on our employees' health. Let's take away the candy machines. It's like, okay, now they're going to murder us. So that's not a good focus for my own safety or my own health. And I also never wanted to micromanage an employee's diet. Like you're an adult. Most of you are an adult, and you have to take control of your own life too. But what you said in the beginning of this session here really hit home with me of making sure you're training people and it's not one and done. oh, here's the lunch and learn. Okay, you're good to go for the rest of your life. It's like, no, people have to hear things a million times before they start saying, all right, this might affect me. Hey, JC, I think you have some stats you want to share.
Boosting employee engagement and morale is vital for a positive work environment. Statistics show engaged employees are 17% more productive, and companies with high engagement have 59% lower turnover rates. Back to you.
Not like we have any turnover rates recently in the past few years, right? Michelle, anything you want to add about these statistics and the fact that employees can be more productive just because of, well, in addition to other things, health coaching?
Yeah, I think it's such an important one. And you guys had one of the episodes with Tony Chapman. It was a few weeks ago at the time we are recording this, but I loved his definition of engagement, which is how much they care, right? And for me, when I talk to my clients, especially my one-on-ones who are in these teams, who are leading them or on the executive things and the boards, how much they care is directly tied to how much we care about them, right? And how we show that. And things like really robust wellness programs show that you care, right? And I think it means that you care about their health, you care about keeping them on the job, you care about their energy and how they feel when they do it. And that like ongoing piece we talked about right at the head of this is such a beautiful way to demonstrate that. Because when I don't feel cared for, it's in a 30-minute lunch and learn I never hear about again.
Yeah.
Right? I'm sitting there hoping I don't snack on the crappy muffins that were bought. And the intention is really good behind that stuff, but it's not actually adding to the culture, to the engagement, and to the outcomes. So I think having that really robust, approach to it, and that doesn't have to mean a lot of dollars. It just means something well thought out, something targeted, something ongoing, is a huge piece of making them cared for. And again, that engagement, those stats on engagement always blow me away because retention is so important. Like, how much money does it cost every time you have to train someone new? If you could keep them, amazing. And one of the things I really loved is that if I look at things like engagement, I had this, and they were quite a progressive team, and they're with a manufacturing company. I was so surprised when I walked in at how cool they were, quite honestly. Maybe that's me stereotyping like manufacturing execs. But their leadership team, and they were close-knit before, but when I walked into that first sort of group one, there was joy. They were championing each other. They were sharing their wins. They were like super pumped that this one guy who'd been very on back end reports, like not very friendly, not very social, he'd lost 35 pounds. He was hiking with his teenage daughters on the weekend. He was off his diabetes meds. And he was like the funniest, most like engaging person at that first session with me. And so I think that when you care and you bring those teams in and you bring that community, your employees feel important, and that's going to save you the dollars, right? Both in healthcare costs, but in that absenteeism and turnover and engagement piece that's so important.
Bam, I couldn't have said it better myself. That was just amazing. Thank you so much for that. And thanks everybody for listening to episode 3 of our 5-part series on the benefits of offering health nutrition coaching to employees. In our next episode, we're going to cover enhancing productivity through nutrition. Thanks for joining us.
Thank you for joining the HR Empowerment Podcast, brought to you by Aurora Training Advantage. We hope you've gained new insight and strategies to navigate the HR profession. We look forward to you joining us again on the HR Empowerment Podcast.